wrapping up our summer months and start getting ready for the fall. We got fall sports starting back, and school will be starting back soon. I think we have just over 150 days left in 2023, and it's also, I happen to see it's National Ice Cream Sandwich Day. So hope everybody can enjoy an ice cream sandwich today. Speaking of schools, Maggie Dangerfield's in training today, who usually represents Charleston County Schools in our meetings. She did say that she apologized for missing. She wanted to be here. She had a couple of updates, is of course welcoming back teachers on August 16th. They're going to be welcoming back students at Charleston County Schools on August 23rd. And they'll have their back to school hotline running this week. And it'll start running the week that school starts. And they're going to encourage everyone to please electronically register students if they haven't already done so. And they look forward to seeing many people at the First Day Festival, which will be August 13th. It's a great event that they do every year. And they hope to see good attendance. We also have sitting in for Jennifer Brush is David Gear, the Charleston Clinic Director for the Charleston Dorchester Mental Health Center. And sitting in for South Carolina DHEC Low Country Region is Lamar Hodges. And he's a community engagement specialist for the Low Country region and leads a team focused on the Tri-County. So glad to have everybody. Thank you all for joining us on this August morning. First up on our agenda is the minutes, which Paul sent out earlier. Can I get a motion to accept the minutes from May 3rd, 2023?
I'll move for approval.
Move for approval of to approve the minutes. Do I have a second?
Second.
Okay. All right. All in favor of approving the minutes for May 3rd, please say aye. Aye.
Aye.
Any opposed? The minutes are approved. And okay, so next up on our agenda is Shelby Joffrin. She's the City of Charleston Police Department Coordinator for Special Projects, Technology, and Grants. And I'm going to ask Shelby to give us a little more information on her, if she would. We appreciate her coming on and giving us an update on what some of the great things that she's doing in the community. So, Shelby.
Yes, sir. Thank you so much for having me. I do have a slideshow to share with you guys, about a 10-minute talk, and we'll talk about some numbers, what the grant is that funds me. We'll talk a little, it's just COSIP, and then we'll talk a little bit about SCORF, and then we'll look at some numbers for Charleston, City of Charleston. So I'm going to share my screen.
Yep, we got it. Thank you.
Okay, sorry, apologies. All right, so let's go to the beginning. Apologies. I'm sorry, I'm just technology. So part one, we're going to talk a little bit about opioid crisis in Charleston and the numbers. Where's the money coming from? What are area LEAs, law enforcement agencies, doing to help? And then next steps, questions, all that good stuff. Part two, we don't have to go through in depth. It's I thought it would be beneficial for you as the committee to see the training that I do at the libraries every Thursday. And we'll just slide through those slides pretty quickly. For Paul, are we ready to go?
Yes.
Okay. All right. So I primarily funded, this is by a grant from the BJA called COSIP, that stands for Comprehensive Opioid Stimulant and Substance Use Program. It was awarded in 2021 to City of Charleston / Charleston Police Department. Those funds were about almost $1 million, and they were divided over 3 years to meet the goals of the grant. We are already, I can tell you right now, looking at least a 2-year extension. Those funds are to be utilized within Charleston County, and Charleston Police Department wrote the grant. However, I do have a growing coalition of law enforcement agencies that I work with that's part of what the grant requires. Currently Mount Pleasant Police Department, North Charleston Police Department, the Sheriff's Office, and then tangentially Sullivan's Island, Folly Beach, and Island Palms. SCORF is another pot of money that that I utilize. These funds were just awarded in April. The grant was written by CPD. It was awarded to the city of Charleston. I can't speak to what the other agencies are utilizing funds for, but we wrote to utilize funds for NARCAN kits, transportation, and technology. So let's go back to COSIP. There are three primary goals of this grant. One is harm reduction, and that's through NARCAN kits. And we'll go into each one of these a little more in depth in just a minute. The second goal of the COSIP grant is deflection to services for law enforcement. That means we want individuals with substance use disorder to view police assisted recovery as a community oriented thing to get them out of the system and out of that cycle of incarceration and addiction. I think it's fair to say that law enforcement will always have the view of a pathway to recovery. And so these are two of the organizations that I primarily work with and learn from, and that's PARI, the Police Assisted Addiction Recovery Initiative. And the second is treatment alternatives for safe communities. I have garnered so much respect and obviously there's so much work behind the theories that these two organizations have compiled over the years. The third is the cross-jurisdictional and organization communication. That by far has been my favorite, getting to meet with area law enforcement agencies, getting that partnership up and running. And then of course, Judge Hendricks' ACT Force is just a powerhouse. So let's take a little bit of a look at NARCAN. So we did a PR campaign, and we are still, obviously it's so in progress right now. The first 564 kits to come out of my grant, that was about $30,000. And that was quite a day when those were delivered to my office. It was incredible to see that much here. So the NARCAN kits, of course, have fentanyl test strips, 2 doses of NARCAN, informational card, a CPR face mask, and gloves, protective gloves. These are distributed throughout Charleston County. Yes, I work for CPD again, but I go to parades and festivals throughout Charleston County. I have a cute little NARCAN cart, farmers markets. Marion Square, I put in specifically because I wanted to speak to an incident that occurred in May. I was just doing my normal research through our incident system, and I noticed that there were 5 overdose deaths within 48 hours. I contacted my contact at the coroner's office. They had noticed it as well. And we were able, through ACT Force, which we'll talk to in just a second, able to get a message out to area organizations. And what was happening was it was cocaine and fentanyl being mixed together. So your normal cocaine user was thinking that that's all that they were doing, and it was actually a fatal dose of fentanyl. So with that information, we took location. We were able to target a location. We were able to target a actual demographic. And so I went and walked Marion Square and some other areas downtown, specifically talking to people and giving them NARCAN and saying, please be careful. And that was one of the most impactful things that I've been able to, boots on the ground do since I've been here in Charleston. Otherwise, it's handing out NARCAN kits and educating, right? But when you can actually target something that seems emergent and acute, it's that, that rush. And all the systems that we are working on were all put into place, the communication across agencies. Of course, the Citadel Mall and the homeless camp distribution. And I want to give a shout out to North Charleston there, because they have a little bit of a larger homeless community than we do, and they do an incredible job with getting information out. With that NARCAN kit as well, there is police department front desk pickup, no questions asked. You just go in and say, I'm here to pick up a NARCAN kit, and they slide you one. Home drop off, there's QR code. On a weekly, I say we get about 5 to 7 a week that are home drop offs, and it's no contact. I just drop it at your front door and go, or a police officer, whoever I can get that's maybe on that beat, and to drop it off for me. And I'm still working with the public libraries to get that, get them to also be a distribution point for us as well. If you take a look over here at the police officer, this is the generic police officer card. Under this QR code, there's a link tree, and you can also request a NARCAN kit through that as well. And this kind of gives you an idea of what my distribution looks like. So that first 564 kits did not just go to CPD. They went to the sheriff's office, Mount Pleasant, North Charleston, fire department, St. Andrews. I mean, these are all, you can all see, local businesses, event distribution. So they're not just going to City of Charleston and us. Any questions so far? I'm gonna keep on going. Awesome. The second part of what I do here is that deflection and community partnerships. These 6 pathways are of a variety of ways that law enforcement and local governments can get involved with recovery and substance use disorder. Right now, City of Charleston Police do part of naloxone plus, part of active outreach, and part of self-referral. I'm not prepared to go into how we do that specifically, but these are all interchangeable, and it's what works for your agency. It's a really good way to pick and choose what works for you so far. Another part of what I do, is that cross-jurisdictional communications, So if someone ODs in City of Charleston, but they live in Mount Pleasant, what is a good record-keeping management system outside of Excel that we can communicate that and be able to track the follow-ups? So we have SIMS. SIMS is Critical Incident Management System or software. Pam Kelly and Sean Verano are at the top. They created this system. They've had massive success in the New England area, in Massachusetts, New Hampshire, those areas. And we went live with SIMS in November. What's great about this is, let's take a look at this first record here. I went ahead and blanked out the names of the victims, because they are victims. This is just a great view. This was a non-fatal event. It happened in Mount Pleasant. But the client, the victim, actually lives in Hugie. So if we had Hugie on board, they could then reach out to that person and say, hey, you doing okay? And do the follow-ups. Mount Pleasant, I'm going to give them a shout out because they actually work with Wake Up Carolina. Wake Up Carolina is able to do their follow-ups. We are in talks to do that with Favor Low Country. So you can see here, this is the screenshot was taken a while ago, that the last follow-up that was done was in June. And we can continually do, depending on the law enforcement agency, there are different workflows as to how many times we follow up and all that good stuff. You can see here, this person has, in this system since November, has had 3 incidents. So this is a great way for us to track and communicate these across jurisdiction. You can see, so Stephen is in Mount Pleasant. Of course, I'm here. And then Ryan Terrell is in North Charleston. So this is a massive communication undertaking that's going well. This is a really cool slide. I think it's really, really neat. And like I said, it's probably been my most favorite part of what I do. And that's working with all of these area organizations. ACT Force is Addiction Crisis Task Force. It is led here by Judge Bruce Hendricks, and we've got Commissioner Gil Kerlikowski on board as well. And we meet every other month with the intent to provide a place for all of us to get together and talk about what's going right and what's going wrong. And it's just such, Judge Hendricks has really created an atmosphere of collaboration and information sharing. So in the interceding months, there are subcommittees to that larger task force. And I sit on the education committee, and also just by default sit on the law enforcement agency case review committee with some of our sworn officers. The education committee goes out into Charleston County schools and does presentations on substance use disorder. And then the law enforcement agency case review committee rotates by agency, utilizes a specific incident, and we will discuss the specifics, what went right and what could be improved upon. And like I said, I'm involved on that committee. I sit in and I listen, but primarily it's our sworn police officers that take the lead on that committee. So I report out once a week to a variety of individuals, and I report out what's going on, what incidents have happened in the last week, what events, what outreach is going on, and then just a basic report out. I also put out a monthly newsletter that talks about COSIP, that talks about addiction. Each newsletter has a different educational piece. And I was encouraged here at CPD, one of our investigators was like, don't just put out fluff, put out stuff that people will actually learn from. And so that's been a really interesting thing to have officers come in and ask questions about some of the articles that are in that newsletter. So that's all I have for COSIP. Like I said, I also have the slides to go through on the NARCAN training that I do, but I'm just going to pause right there and take any questions and let Paul kind of lead me.
Any questions?
Kevin,
Go ahead,
just
Paul, I'm sorry.
a couple of questions. One that we had earlier. When you talk about your NARCAN training in a few seconds, I noticed CFD is also doing NARCAN training. How do y'all two coordinate what's being done in our city?
I'm sorry?
When you do your NARCAN training, it seems like it's coming out of fire departments doing NARCAN training as well as the police department. Are y'all working on the same calendars to cover areas?
We are not. We are not. So, that is a note to be made. I know that I am working on the same calendar with other law enforcement agencies, which is I've got 3 within City of Charleston jurisdiction, a couple in Mount Pleasant, a couple in North Charleston, and a couple in county. But it never, maybe that's just a fault of mine. I would not have thought to coordinate with the fire department.
Yeah, Shelby, just to go off of what Paul was saying, I think it was about 3 weeks ago, maybe a little bit longer than that. I did take a NARCAN training that the fire department did at Citadel Mall. And, and I know you have one coming up Thursday night, I believe, at the West Ashley Library over by Beesbury by West Ashley High School. So I think that's kind of where Paul was coming from. Is there any coordination there? And it may just be good to coordinate both police and fire on that.
Absolutely. I will say also those first 500 NARCAN kits, the senior class at West Ashley packed those for me. It was a really great way to get them involved and get that little education piece out. And that was incredible. So.
Oh, that's great.
Okay.
Kevin, the second question I had was just on the sheet that you had where y'all doing follow-up in communities. That seems like a daunting task. How many cases would you say since where we are this year that you're having to do in follow-ups?
So let's take a look at those numbers. I'm going to go back to sharing. So let's see, where did I apologize. Here's, okay. So this is what this year looks like so far. So far in 2023, this was as of like the end of July. So far we've responded to a total of about 150. 117 of those were non-fatal. 34 were fatal. And what I'm finding in the incident reports is when they're a fatality, they're already deceased when first responders get there. And so we take those 117-ish and then we break them down over here. So about 50, there is no note in the incident report if NARCAN was administered or not. But those that did have NARCAN administered, about 14 of those were bystanders, which means people that had it on hand. This is where that community engagement piece comes in. It's, you know, a local business, a friend or family, something like that. CPD administered 14 times, and then fire and EMS administered 37 times. So Paul, to speak to your question about like the numbers that we're looking at these that were the surviving ones, and are they going to accept outreach or not? If there's another person on the incident report, friend, family member, reaching out to them. And it is a daunting task, but it's doable.
Well, we praise you for all that y'all are doing. Wow.
Did I answer your question?
You did.
Okay.
I think Mayor Tecklenburg has a question.
Oh, yes, sir.
Thank you, Shelby. Thank you for the wonderful work you're doing here. I'm so pleased to hear your report. I am a little more curious about the numbers, you know, because I've been reading that nationally. I think the national number of deaths last year from overdose were over like 110,000 in the country. And I'm wondering, and one is too many. 34 seems like a pretty big number to me. I mean, it's over 4 times what our homicide rate is in the city. Yes, year to date. How do we compare, if you look at the, you know, per 1,000 in population? You may not know this off the top of your head. And how do we compare also to our own city, you know, year to year? Is 34 a lot more than it was last year or the year before? Do you have any history on that?
So we are pretty much on par for last calendar year. As you all know, the pandemic really jumped our numbers, and I can give you the information that I do know and then get back to you with more information later. Okay. But we're the 3rd highest county in South Carolina for overdoses and overdose deaths. That's behind Greenville and Myrtle Beach. And then there's Charleston. So it's definitely, we're not at the top, but we're close to the top. And so, yes, 34, Chief Walker and I've talked about this several times, how there is, when you speak in terms of calls, emergency calls, what percentage are going to overdoses? What is our percentage? And 150 some odd calls in 6 months. That's a lot of calls for service. So it's getting that education out, and also the awareness that fentanyl is being mixed with everything, and it is incredibly fatal.
Yeah. And that 34, that's city of Charleston, or that's Charleston County? That
is city of Charleston.
City of Charleston. You know the number for Charleston County?
No, sir, I don't. I'm sorry.
Okay, no problem. All right, well, thanks again for your fine work. We need to keep this up because it's a killer.
Yes, sir.
Yeah.
Okay, and I see someone with their hand raised.
Oh, I'm sorry, Meredith Berlinski, please. Thank you.
Hey, sorry about that. Shelby, just kudos to what Charleston's doing and what you're doing through that program. It's amazing. I started the NARCAN program here at Roper St. Francis as well because of our pain centers, our chronic pain centers, our things where medication is actually going out, sending that education out as well. So I just think what you're doing is amazing. I didn't know if I got your information actually from the last page of your presentation. I was going to email you a little later and see what the hospital can do to speak with the city of Charleston, CPD as well, or just to kind of collaborate numbers and such because of what's coming out with from the hospitals, and we have patients coming out because of some of those medications we write. So being involved in that, I think would be a good joint venture. So I'll email you later about that. But kudos on what you've done. It's amazing.
Yes, sir.
Great job for what this city needs.
I appreciate that, but obviously we all know that there's more work to be done, and we'll just keep on keeping on.
Great. I'll email you. I'll
Sir.
contact you about that.
Okay.
Great. And I think some of you have seen that Chief Cheeto Walker is on the line with us too. And we appreciate him jumping in and joining with us. Thank you for being with us, Chief.
Thank you so much, Councilman. And as Shelby said, this is really our public safety issue number one that's not getting a lot of attention that it needs. And she made a comparison to the homicide rate. One homicide is one homicide too many. But when you start talking about the number of deaths that we're dealing with, especially this year with the overdose, it's astronomical. So trying to educate the public, starting in the schools, any community meetings that I'm going to, this is pretty much the discussion. People don't know, and just trying to educate them on the effects of fentanyl, and trying to do everything we possibly can just to at least educate our community is like I said, is priority number one right now. And Shelby's doing an outstanding job.
Thank you. Thank you, Chief. Well, I want to show you guys just briefly those slides that I go through for the NARCAN training. Paul, do we have time for that?
Yes, we do.
Okay. So I'm going to go ahead and share my screen really quickly. And I promise then I'll be quiet. Okay, so whenever you come to the library, you will come in. There's all kinds of resources as participants walk in. I also break the training up into 2 sessions. One, if you're just there for the training and that kind of information, that's only about 30 minutes. If you want to stay and get a little bit more information, just like I just presented to you, you can stay. Otherwise, thank you for coming, So we do a little bit on what are opioids and how do they affect us? Why do we need to be cautious? That kind of thing. And if I'm going too fast, please, someone let me know. I show a small video on how utilizing opioids legally can then turn illegal or illicit, how overdose works. And remember, I have to really speak to the general public here. I have to assume that there's not a lot of knowledge there. What to look for whenever you think that someone may be overdosing. And then I utilize the NARCAN video for the actual training. However, we have here in Charleston a couple of caveats. For example, they say to put a victim in what's called a recovery position. We do not suggest that just because you don't know what other injuries that person may have. So what do? We also say to here in Charleston to dial 911 first and put the call on speaker, then start the NARCAN process, so that you already have 911 communicating to first responders to get them out there. The other thing that has been a really big like light bulb I've seen in talking to the general public, do not prime Narcan. It does not need to be primed like Flonase sometimes, or other nasal applications. You have to prime it before it actually, the medication actually dispenses. That's not true with Narcan. It, once you do the initial dispersion, medicine's gone. So, what things that we need to know about Narcan? These are just general questions that people have asked, and so I address them here. Primarily Good Samaritan. It reverses for overdoses for opioid only. So anything that's something that's a stimulant, but not an opioid, it won't work on, like cocaine, depressants, it won't work on, only on opioids. Expired Narcan still has a shelf life, and that of course diminishes as time goes on, but there is a whole chart that you can take a look at. So if all you have is expired Narcan, at least give it a shot. And then the duration of Narcan in your body is 30 to 120 minutes. So I still want the education piece out there that if you overdose, you've used Narcan, you can still have a lethal amount of drugs in your system, that it's important for you to get to the hospital because that Narcan will wear off. And then this is just tips for parents. I've had quite a few parents come into trainings or ask questions. And this down at the bottom, the just say no, that's not just me putting that on a slide. That is something that's gone through discussion with ACT Force and the folks from DEA and HIDA, that how do we approach drug education in our schools and with our kiddos. And again, we went over the numbers. So again, any questions? So this is about a 30-minute training, but I feel like it covers a broad base of information quickly. And I'll stop talking.
Joey Current.
Real quick question, for folks who are out in the community and maybe are in situations where they may experience someone who's overdosed and they're not carrying their Narcan. Do you have any suggestions, as you've been out in the community trying to distribute these kits, of where good places to go to if you find yourself in need of it in a quick situation? And just run to. I know you mentioned maybe the libraries is one area you're trying to work with, and obviously the police station and fire departments. But anywhere else people should keep in mind that they can get Narcan quick if they need it? You're still muted.
Sorry. 3 years and I still end up muted. I target food and bev. I target bodegas, convenience stores, things like that. Just keep it under the counter. You never know. And so I believe it was January, February. We had a bystander. There was a victim overdosing in downtown, and the person ran out of the store and said, I have this, as I understand from the incident report, and the police officer that was there. Of course, all of our police officers carry Narcan as well, but the kit was already there. So the police officer said, yeah, sure, and utilized the Narcan from the emergency kit that we then replaced. So does that answer your question? Great.
Mayor Tecklenburg has a question.
Yes, sir.
Yes, thank you, Mr. Chairman. Shelby, you mentioned that just say no doesn't work. Of course, I'm naive, and it seems so scary to me. You described that situation where cocaine got mixed with fentanyl and 5 people died. They were, they were just cocaine users, and it's being mixed with so many things that I don't know if people are not scared of dying, but it would just seem to me there's some fear there that you could be killed. What works? What is it? Testimonies from people who nearly died, or from parents who lost their loved ones? Is there something or 1 or 2 messages that do work?
I think just the education piece, like you said, Nancy Shipman has a great program in Mount Pleasant with Wake Up Carolina. You know, she lost her son to opioid overdose. Testimonials for people with lived experience, peer support people being a part of this mix. Part of it though, and that's educating the community at large. From my background in education though, that education piece and remembering that your frontal lobe is not developed, your decision-making centers are not developed. So just making sure that they have the right and real information, of course, age appropriate, but making sure that they have information in order to make those decisions. And fentanyl is in everything.
Yeah. So
Yes,
it's
sir.
like everything else, getting the
And I'll
word
defer
out.
to Chief Walker for further on that.
Yeah, Chief Walker.
Thank you.
Yeah, and I just wanted to add in, Mr. Mayor, and I know some of the questions, and it's not just a cocaine thing. And I know when we start thinking about drug use, but this is impacting every aspect of recreational drug use. So when we start talking about our youth and education, it's also impacting marijuana. You know, you have marijuana's being laced with fentanyl. You have them taking pills that they think are certain pills, but actually are straight fentanyl. So when we start talking about every facet of the community and getting the message out, that's kind of what we're talking about. So we're open to any ideas. And like I say, the more we talk about it, the more we educate, hopefully the better outcomes we have in our community to start with and then branch out. So I just wanted to add that piece. We've had an incident where we had an overdose with a young teenager that he thought he was just smoking marijuana.
Yep.
And it was not good. So we just need to tell these stories. And like I say, recreational drug use is not similar to doing Russian roulette right now with the fentanyl crisis.
Yeah. So excuse my ignorance. You smoke fentanyl as well?
You can, yeah, they look for a greater high.
Yeah.
So they're sprinkling in marijuana to achieve these highs. It's become, fatal in some cases. So you can smoke it, you can shoot it, you can take it over the counter. Fentanyl is just like any other powdered form of narcotics. So, but it is a lot more fatal.
Right.
There's
I get that.
do you mind if I make 2 points there? Just like Mr. Berlinski just said, fentanyl or alluded to, fentanyl is a legal painkiller. And oftentimes whenever it can be illegal and produced legally and utilized legally. And so oftentimes whenever a patient is prescribed fentanyl, they're also prescribed NARCAN as a backup. So it can be utilized in just like everything else, it pretty much, it can be utilized legally for good. It's those illicit substances that it's not, they're being produced in illegal labs where you're not dealing with a homogenized product. You're not dealing with a scientist that is administering this product. And that's where the fatality comes in. And the second point I would make there is oftentimes people ask, well, why would a dealer want to mix in fentanyl and kill their client? Well, fentanyl is highly addictive. And so if you can have a client that will be a return client over and over again, is it worth the risk of,
They don't care.
No.
It's a cheaper cut also.
No.
And
yeah, that's true. It is cheaper.
It's cheaper to cut with fentanyl. And like I say, I don't want to get into the weeds,
Yeah.
but it's a cheaper cut. It's easier, but it's like I say, 10 times more fatal. Wow. And they're not worried about their clientele. It's a money making.
A return client.
Yeah. So.
Yeah. The fatal dose of fentanyl is in the powder form is the amount that goes on Lincoln's ear on the penny.
That goes where, Meredith?
I'm sorry?
I'm sorry, what did you say? It's the amount that what?
The amount that fits, the amount of powder that fits on Lincoln's ear on a penny.
Oh, wow.
That is a fatal dose of fentanyl.
My God.
And we've actually changed, American Heart and American Red Cross has changed the BLS or the CPR just teachings, and all the literature has changed, that if you're giving CPR to someone and you notice a medical patch on them, that if you don't have gloves, you're not supposed to touch it because you don't know what it is. If it's a nitro patch, then it could drop your pressure down and you fall. Or if it's a fentanyl patch, there's been a lot. I mean, YouTube has the videos of officers not knowing what it is and touching it and then just collapse. That's how quick that is. And if you don't have Narcan, you have, like they were showing you, you have seconds.
Wow.
I do have an illustration, if you're interested, Mayor Tecklenburg, of that, that I can pull up really quickly.
That'd be
That's
fine.
it's part of our educational piece. This is the slideshow that we use for Act Force. So down here at the bottom. So these were lethal doses of heroin. Fentanyl, you can see, is just tiny. And then carfentanil is, of course, a derivative of. And just like was mentioned, what will fit on Lincoln's ear.
Wow.
So, anyway. Sorry.
Any other questions or comments?
I guess I have one question. I know Laurie was on, I think she may have left, but should city offices have a kit on site just as precautionary? I think people are more fear about giving it and a liability of giving it, but it sounds to me from what the question that was asked earlier by Joey, it seems like the availability of having it is the most important part. And I'm just wondering, rec centers, swimming pools, other areas, should they be equipped as an emergency situation?
Yes, sir. And I've hit quite a few rec centers in the area, some housing, but swimming pools, great. Yeah.
Also, it doesn't harm anybody.
Right.
If you give it and they don't need it, or if you give it to an infant, has it at home and accidentally sprays it, it does nothing. There's no side effect to Narcan. So you're not hurting anybody if you accidentally give it. So that's the safe part about that too.
And while I've got Shelby on hand, I'm not going to miss the opportunity that they have on site a red box in the lobby that if you've got expired drugs or drugs that you are no longer using, it's a disposal that you can drop off at the police department and just put them down there and they will disperse of them the appropriate direction. And we'll try to get that message out more and more about where those drop boxes are throughout our community, because if you don't want it at your house, we have a place that it can go to.
Mm-hmm. So, well, Paul, I wanted to say thank you. I really appreciate this opportunity to get information and education out about what I'm doing. And I certainly appreciate everyone else's role in what we're doing here in the community. And thank you. Please reach out anytime if I can be of assistance, if I can provide kits. But Paul, yes, I will see about getting some kits more in city offices as well. But thank you so much for this opportunity.
Thank you so much. Appreciate everything. Such an important issue, and appreciate all the work that you're doing. And for those of you on here, if you would help us get the word out, Thursday evening, West Ashley, like the Bees Ferry West Ashley Library, there will be a Narcan training there. I can't remember if it's at 6 o'clock or 6:30. 6 o'clock. Okay, 6 o'clock. So if those of you out here can help us get the word out there, that would be great. So thank you so much, Shelby, for all of your work and spending so much time with us and educating us on this. Thank you. And I did want to mention Jerome Smalls from the mayor's office. He doesn't have his camera on, but it's his first time being on this with our committee, and we are very, very excited. He's new to the city. He's a great young man, and we're excited to have him. So welcome, Jerome.
Thanks for having me. I appreciate it.
Yes, sir.
And thank you, Shelby, for all of this. I learned so much today.
Yeah, the good thing about Jerome is he grew up in North Charleston, went to West Ashley High School. My wife talked about how great a student and person he was, and was well respected over there. And now we have him here at the city in our mayor's office, helping out with other initiatives. And so we're glad to welcome you aboard.
And to boot, he's a fellow alumni of Georgetown University, Hoya Saxa.
All right. Well, very good. Well, welcome, Jerome. Thank you.
Y'all
for
making
being
me blush, man. Y'all making me blush. Thank you so much. It's been an honor to be here.
All right, great. Well, as I said earlier, Lamar Hodges is sitting in with us from South Carolina DHEC, and he's going to be giving us our community health update for Dr. Katie Richardson. So, Lamar, please.
All right. Thank you so much, Kevin. I bring you greetings. I am Lamar Hodges, the one of the community health systems program manager. And of course, I don't have all the information that Dr. Richardson normally would probably provide, but I do have some updates and some reminders for everyone this morning. The first thing is that, of course, just want to just kind of celebrate that, you know, this year, July 1st, DHEC has celebrated 50 years of excellence. So we've been out here doing that service and providing that, all of what we can do, healthy living in healthy communities for over 50 years. So we do celebrate that as it pertains to July 1st of this year. Of course, in the sense of with my program, we will be, and with of course, celebrating 50 years, we're going to be moving into a lot of changes when it comes to South Carolina DHEC. As it pertains to with my program, we are changing our name to the Community Engagement Team. What that looks like and why we end up doing that is because, of course, what we're looking to do is really be more for people to understand what we do and be able to be out there more in the community. What that does, it doesn't change what we're, some of the initiatives that we're going to be working towards. It does strengthen what we will be working towards as it pertains to those assisting with chronic disease prevention, as well as, of course, being able to go out there and help with those program initiatives and working with those persons with preventing with physical activity, obesity, of course, when it comes to tobacco use, and then also being able to focus on more of our what we consider as PSE, policy system and environmental changes. We got a lot of strategic planning going on that we'll be working towards with all of these changes, which is all a great thing. So that is kind of when it comes to those updates. Just wanted to do a reminder as it pertains to this health-wise. Understand that COVID is still here. You know, we do understand that, of course, in situations it may not be as intriguing as and severe as most people have seen it before, but we just want to remind to take those precautions as it pertains to if that person is identified with those symptoms, that they still remain and understand that within that 5 days, be in isolation for 5 days. And then, of course, once after testing positive and being in isolation for 5 days, then be able to return to your normal duties. For more information in that, of course, definitely visit our website, scdhec.gov. But we just want to make sure that everyone continue to stay safe, being healthy. And of course, this year, I know for a fact, with the changes that we have, we look forward to doing some great things and working with the community as much as possible.
Great. Thank you so much. Appreciate you filling in and giving us a great report. Any questions from anyone? Mayor Teckenberg?
Thank you, Lamar. I just want to comment. I like your shirt, man. Nice shirt. Oh.
Thanks. Kind of similar to yours.
All right. Well, very good. Well, we appreciate the update. Thank you very much, and all that you do at DHEC. So thank you so much. So we'll move on to our community health and wellness updates. I know David Gear is sitting in for Charleston Dorchester Mental Health. Didn't know if you had anything you wanted to update on us.
The biggest update for us is that we just completed our mental health conference at the Gilliard Auditorium on Thursday and Friday. Well, really Wednesday through Friday last week. It was extremely well attended and appeared to have been a significant success. So we're really happy with how that went. Other than that, we're just preparing our school mental health services for the coming school year, having conversations with the school district so that we can make sure that we're in place to be able to serve all the students.
Very good. Well, thank you. And I happened to see on the news the other night that the athletics in Charleston County is putting a particular focus on mental health as well. So that's great. So appreciate all your work and everything you do over there. Thank you.
Great. Thank you.
All right. Joey, any updates? Joey Current from the Trident United Way?
Yeah, just a real quick update. As many folks know, we have a new CEO who's been with us for a couple of months now at Trident United Way. And we are doing our first inaugural State of the Families address on August 23rd. And we're going to be talking about many of the things that we talk about on these calls, what folks are dealing with out in the community and barriers to health and wellness and self-sufficiency. Got a great panel of speakers who are going to be speaking. It's going to be at Trident Tech. And so I'll put a link in the chat for any folks who would like to attend that. It's a great way to kind of really get a landscape of what folks are dealing with in our communities. And I encourage folks to attend.
Great. Thank you so much, Joey. Nick Osborne, any updates?
Yeah, no, thanks very much, Kevin. One thing I will highlight, it's a bit of a way off, but just to get it on people's calendars perhaps, is in recognition for Hunger Action Month, we have our annual Walk to Fight Hunger that's taking place in September. It's September the 10th from 11 a.m. to 2 p.m. It's at Wanamaker Park in North Charleston. We had a great turnout last year. This is the third year that we've done this. Obviously to highlight issues associated with hunger during the particular month. It's a family event. There'll be lots of activities. There'll be some fun walks to do as well. There'll be both a short one and a longer one. But Kevin, if it's okay, I can share you a link that you can maybe share around just to give a little bit more information about it. But I just wanted to highlight that taking place in September.
Perfect. Yeah, send that and we will certainly share it. Absolutely. Thank you. All right. Dr. Meredith Belinsky, anything from Roper?
All right, fine with me, but hey, as we are growing, and we are starting to break ground all over. Berkeley Hospital will be doubling in size. That has started. We also will starting with the transition of Roper Hospital to moving closer to I-26 and 526, we all this changing. We're going to have a big diagnostic type imaging lab type whatnot out of Mount Pleasant as well. That's starting soon. So we're expanding, we're growing our wings, and also too. But from what she said, they said earlier with NARCAN, it's any of our ERs as well. Our transitions clinic, which is on Rivers Avenue at the Mark Clark overpass. That's also a place you can go to get Narcan as well. And we're trying to get a little better in the hospital with our community as well. That's why I was wanted to talk with her to try to expand that. But yeah, we have a lot of different things that Roper St. Francis is opening up, and we just Coastal Cardiology just joined Roper St. Francis. That they're now Roper St. Francis physician partners as of 2 days ago. So we've started working with other very influential and very good physician groups to join our network. So it's good growth for Roper St. Francis.
Great. Well, thank you very much. Anyone else with a community update? Well, listen, I sure appreciate everybody's time. Good meeting, very important information. I know everybody on here, your time is extremely valuable. So I appreciate you giving an hour of your time to help the city of Charleston and this Health and Wellness Committee. So it's very, very important to us. And I really appreciate the time and the expertise that you share to help the city of Charleston be healthier. So I appreciate it. Is there anything else to come before this committee? If not, we stand adjourned. Thank you so much.
Thanks, everybody.
Okay,